trying to meet a family whose son Thomas, he had a condition called perinatal asphyxia, or lack of oxygen at birth, and he was quite a sick baby, and he was then randomised by computer selection to have a cooling treatment.
Sadly, even with the best obstetric care, about 1 or 2 in every 1,000 births suffer from lack of oxygen around the time of birth.
When we were told about the news, it was quite devastating. And at that stage, it was a bit of a no-brainer, and we were absolutely all in for going ahead with the trial.
I was in a cold box and I couldn't breathe when I came out of your tummy.
Lots of people are aware of anecdotal stories of near drownings in cold water or recovery from exposure in cold situations. Start off slowly, start off small and gradually reach the point where you've got enough evidence to support running a larger project to try and produce the evidence.
So the TOBY study was a randomised trial where half the babies were treated with standard care and the other half were treated with standard care plus cooling by about 3 degrees below the normal temperature. The National Perinatal Epidemiology Unit is a coordinating centre, and Brenda Strom was the trial coordinator, and they ensured that all the hospitals were properly trained up, and they were the central repository for all the study data, analysed the data.
During the birth process or shortly before birth, that for some reason as the baby is not getting the oxygen that it requires.
You need to start the treatment as early as possible to prevent any injury happening to the brain. So we start within 6 hours of birth, after giving enough time for the parents to understand what is going to be done to their baby. And then we get the temperature down to about 33.5 degrees Celsius and keep it there for 72 hours, hopefully allowing time for all the inflammation and other harmful processes to settle down. And then we slowly rewarm the baby up over about 12 hours. All metabolic processes, all processes that demand energy, require energy, are suppressed by cooling. So cooling reduces the energy demand of the brain. We know that that probably then suppresses the inflammatory response, the burst of inflammation and other harmful processes that occur when you've suffered a lack of oxygen. It's something akin to when you have an injury to a joint, you put something cold over it to suppress the swelling and inflammation.
Thomas, can I shake your hand? It's lovely to meet you. Really lovely to meet you. Clearly you were aware that Thomas was poorly when he was born, so can you remember what it was like when you were told about his condition and the idea of the trial was introduced to you?
I was absolutely devastated when they told me about his condition, and then at the same time they did talk about the trial. But I couldn't take a lot of information in, and I was in a bit of a meltdown place.
So one of the hardest things about doing a study like this is that you have to provide a lot of information about the study to the parents at a time when they are very stressed. They've just had the mother's just delivered a baby and has just received the news that the baby is very sick. Therefore, it is very important to try and give the parents time to understand what is happening and what we are suggesting.
When you realised how poorly Thomas was and when the trial was introduced to you?
When we were told about the news, it was quite devastating. But my immediate reaction was, what are the side effects? And then we were told there weren't any possible side effects. The other issue was, would he be cooled or not? And we were in the hands of the random number to see if he was selected or not.
The TOBY study was the largest of a number of randomised controlled trials that explored this therapy. And in fact, when we did a summary analysis of all the clinical trials, confirmed that treatment with cooling reduces the chances of dying or developing cerebral palsy by about 50%. In the context of the United Kingdom, we can predict that about 100 more babies every year are surviving without cerebral palsy as a result of this treatment.
And it doesn't need batteries, so if you squeeze it, that's how you recharge it. So you're probably aware that NICE recommended cooling as standard treatment since 2010 actually. So how does that make you feel?
I think it's absolutely fantastic, absolutely fabulous. You know, if there's anything that you can do for a baby that has had some injury when they're born, then that is just brilliant.
Brilliant. Bye-bye. It's very rewarding to come and actually see the evidence of a baby who started off in lots of difficulties and has clearly done very well and continue to stay well and healthy, because not all of them do, but Thomas is certainly a perfect example.